morning, everyone. Buenos dias. What day is today, Natalia?
Friday. Happy Friday.
Happy Friday. Oh my gosh, my favorite day of the week. We have our special guest today. She is a Dr. Natalia Villegas. I'm very excited to introduce this community partner. Natalia, please introduce yourself.
Well, thank you for the invitation to be here today. Well, as you said, Ivania, I'm Natalia. I'm a nurse by training. I'm also a lactation consultant. I'm currently working at UNC Chapel Hill School of Nursing. I'm one of the faculty there. And well, is for some people it's hard to understand what I do, but basically I'm a teacher. I teach, nurses, but also part of what I do is also research. So one of the things I focus my career has been in developing prevention interventions, specifically, I'll say mostly for Latinos and Latinas in North Carolina and other areas of the United States and Latin America too. I've been focused more on HIV prevention throughout the years, but also I've been working in other initiatives related to HIV prevention and women's health.
Natalia, also I want to remind our viewers, our audience, that this interview is going to be in English. And then we will have another one in Spanish. So whatever makes you feel more comfortable to hear at, this is going to be maybe 20 minutes, something like that, in English. And also I'm excited because Natalia's origin country is the same as mine, Chile. So we met and we connect very great because, as she shared, she also has a passion for help communities in her field, in the health, and I have a passion to provide information and connect resources with the community. So we match perfectly, and I'm excited about sharing that she's going to also be in our event tomorrow at the soccer in Apex, and on Monday at the Ciclodanza Movement and Inclusion at 6. So what are you going to be specifically doing there, Natalia? Let us know.
Well, that's I'm really happy to be joining the event. What I'll do the most, we always, as part of our mission, also is connect with the community. Most of the work I've done always has been community based. So that's really bringing resources and helping the community because especially what I do is in health because that's my background and my career. But specifically, we have a project now that I'm leading, and I would like to invite women to participate. This project now is focusing on Latinas, which doesn't mean that in the future we're not going to open up for other communities too or minority groups. This project is an educational program that we developed years ago. This project is an educational program that you can learn about HIV prevention, but also you can learn about other things related to HIV risk, which, for example, sometimes we have abusive relationships. Also, we have, substance use problems, and also we have sometimes, problems to communicate with our partners or mental health issues going on. So this is an educational program in a format of a soap opera where you can look at, you can watch stories, and in those stories, they're showing you, how, one thing can lead to the other. And, also, in that soap opera, you can learn about resources and you can learn how to prevent, things happening to you that can really, make your life, more complicated, and they can bring, health issues to you. Or sometimes, the information we share is not just for you. It can be for your friends, for your family. Not necessarily sometimes we're in that situation, but we always have, or we know someone who probably needs that information. And that's the idea that I believe, a community also, we're individuals, but a community that works together usually becomes stronger. And, when one person in the community knows something and communicate that to others, all of us are preventing and all of us are helping each other. So that's kind of the purpose of the project. And the idea
I'm
of this
sorry
soap
to
opera,
interrupt you, Natalia, but let me tell you that I love soap operas, you know, the telenovelas, and I think for me it will be very, very attractive to be informed by a soap opera. So when you tell a soap opera, it's like, oh my gosh, that sounds like a fun way to deliver information that is important. So I'm excited about learn more about that project.
yeah, and we started with that idea years ago, and that was one of the things that we thought about. Like sometimes people don't have time to, because we're working, we have busy lives, especially here in the United States. So sometimes you don't have the time to, or the means, like to go every week to a center, learn about it, something. This program is completely online, so you can watch it at any time. So we try to make it more accessible. Most people use technology. If some people struggle with technology, we can also help and support and guide them, like help them how to get the information. But the idea was like to create other type of prevention that was not just in person, because most programs or prevention education has been delivered in person. But we know times have changed, and some people prefer, a more, electronic format. We're always in social media. We're always communicating with everyone. So this was a way that we created for, an audience that really will prefer maybe learning this way. I always say it's not the only way to learn, but it's an alternative for people who really like this media. And we try to make it really, I'll say, community based. And, we try to usually, build this with the community. We may help us with development of the stories, same, people from the community, actors. So this was, something, it was like an effort that was, multidisciplinary, and also we included the community to develop the stories.
I don't know if people can see what I am sharing. This is the first time that I'm using this feature, so I apologize if people cannot see what I am actually sharing. But I'm sharing what Natalia is talking about. Maybe it's not the
Yeah,
screen. It's
I see the folder, but I see very tiny the flyer. We have a flyer of
okay.
this
Let me
time.
see. Yes, I do have a flyer. That's what I wanted to show, but I am kind of sorry. I'm not a very good at this feature yet. So anyways, I'm gonna just stop sharing because it didn't work the way we wanted. But yeah, Natalia is looking for Latinas, yeah, from 18 to 44 years old to engage in this project of telenovela, soap opera. So she's gonna be also sharing more about that in our event tomorrow, and we're gonna leave the flyer on the comments as well, right, Natalia? But she is also gonna be tell us about two really important resource for the community, especially communities that doesn't have a health insurance in the Triangle and in Durham. So Natalia, this clinic that the UNC offers, can you tell us a little bit more about, who is accessible, who is eligible, who can go, what are the services that people can access, especially in health? Because I saw that what this nurse school does with the community is amazing. I went to visit one in High House here in Cary, and it's really amazing the services that they are providing. Can you tell us more a little bit more about those resources that the community has and maybe they don't know?
Yeah, and like that's one of the things that we're doing to us at school. We have a mobile unit. The physical location, the unit used to be a bus that we were all around. No, like they were able to find a physical location, which doesn't mean that the mobile unit doesn't move, because it's still the unit is going around with health fairs and going to places once in a while. It depends on the invitations and where it's better to reach out people, but they're always moving. But we have a main location now that is in Cary, and well, I think Ivana, you're going to share the information. We do in that. That is an effort of our school. Is a mobile clinic that was we always get like a support from the school to do it. Is more for prevention screenings. So if you are really you maybe not feeling good, you think maybe you can have diabetes or hypertension, or maybe you have something going on with your vision, or sometimes you want to see a specialist. There are several options offered throughout the year. Like the clinics are open Tuesdays and Saturdays. Like Ivana will share the times, but you can
10
walk
to
in.
10 to 2.
Yeah, you can walk in, and we will have nursing faculty, and also that would be also students. There are also nurse practitioners, which is more an advanced degree in nursing, which they can refer you to other services. I think the important here is just sometimes we don't have a time ourselves to check for anything that we're feeling. We don't feel so good, but we don't have the money. This is open to anyone, like not just Latinos. It's any person in the community who wants to get a check. As long as you go in the time that the clinic is open, you will be, seen by someone who is a nurse, and usually there are students who also volunteer, and you can be referred. They have connections with a lot of services. So I'll say it's not just limited to health, because sometimes it's housing, sometimes maybe you need help with food, like, so they also have resources that are not just health related. Like they can be you can be refer, maybe they have connections with other types of services that you can be needing, like you can be in need at some point. Of course.
Natalia, I just wanted to interrupt you. I'm sorry, I didn't mean to interrupt you, but we have some comments, and I like to do this very interactive. Carolina Alfaro, and please jump in if you have any comments about what we are talking, because that's the idea, right? To have a kind of conversation with the community. So Carolina Alfaro says, thank you for the information. In Spanish is more better. And yes, we got you, Carolina. We're going to do a second interview in Spanish, because when we do it bilingual, it gets really long. But we still wanted to, being able to outreach, as Natalia was saying, not only Hispanic can go to this clinic. It could be any person that needs some screening and has some health, maybe screening and health issues, maybe a headache, and is not doesn't know what is going on. That person can be checked in those clinics that you don't have to have an insurance, and it's open to everyone. So that's what we wanted to do in English and then in Spanish. But don't worry, after this interview, we're going to do it in Spanish for you. So thank you for your comment. Sorry, Natalia, I just wanted
We're
to.
almost going to Spanish right now, but I just wanted to say I share also, like I'll share about Shack, other clinic that we have at UNC. But I put Ivania, like the website of the soap opera that I was talking. We also have other community links about some services you may need. Like I've been trying to update it the most, because we have sometimes the need of maybe a mammogram, or people want to do work and get a pap smear and things like that. So we're going to update a little bit more the website of our intervention, but you have information there in Spanish and English about other agencies that provide, sometimes if you want HIV testing, STI testing, mental health services. There's some information there. Usually, everyone is busy, but every time I get any contact or someone needs some services, I try to connect them, as what Ivania is one of the partners that we have. But like, try to see, okay, sometimes we don't have the solution right away for any problem that you may have, but we can connect you with someone else who can give you a hand and help you. And I think that's the purpose of getting this type of information out, like that we can learn a bit more about the services that are available. And sometimes if one agency cannot really help you, then try to help you navigate what are other options you have.
Great, that's amazing. And yeah, Carolina says, "Amen." That we need a translator to better understand the information. Yeah, we don't have the translation in the system right away, so that's why we're doing another one in Spanish. So we're trying to feed our capacity too in terms of the software and the one we're using. But we are gonna do one in Spanish, and I can't wait to also, because that's my mother's language, and that's the one I feel more comfortable to. But again, we are doing an effort here to try to, reach as many communities as we can. Sometimes our kids, for example, they are more comfortable, or younger generations, we were just talking with Natalia, are more comfortable in English. So we just wanted to try to meet people where they are, if they are more comfortable in English, then we have this, and then we will have another in Spanish. And I do really appreciate Natalia's information. I think it's really important. Health resources, sometimes we don't know where to go, and this is a very, very good and valuable information. Natalia was talking about the clinic in Cary, but there is another one, because we have the soccer event that is coming up tomorrow at 6 p.m. is in Apex, but we also have a group of ciclodanza movement classes in Durham. So for people who are in that area, Durham, Chapel Hill, Scarborough, there is another mobile clinic that Natalia is also going to share information in Monday's activity. So that's another mobile clinic that is from the Carolina Nursing as well, right, Natalia? Can you tell us about that if
Yeah,
you
well,
see?
SHARC is I usually forget the acronym, but it's a coalition. That is, the School of Nursing is part of that coalition, but also includes the School of Medicine among other schools. So basically, this is, I'll say, a service that the students are very involved. So also, students work with faculty in terms of helping people. The clinic is in Carville. They can see patients on Wednesdays in the afternoon. The only requirement to be seen is that you don't have health insurance. So if you don't have a health insurance, you are allowed to go. There is no charge. And usually, it's better to schedule an appointment before you go, because usually it gets, crowded, and they want to guarantee that you can be seen that day. Usually it's from, I can check the schedule. I put it in the information, but I think it's from 6 to 10 or 5 to 10.
6:30 to 10, and we're going to also leave the link where you can do the appointment for that clinic, right?
Yeah.
It's
And usually, like,
coalition. Sorry.
they're doctors, they're translators too, they're nurses, they're people who also do labs. And, usually if you have a health condition or acute illness that you don't know where to go, you don't have the resources, you can go there. If they can, they will provide you the medications for free. They will do lab work too. If there is something they can manage, they will try to make sure you get referred to services that can be affordable. So yeah, I think that's a good opportunity. Of course, like, if I know more services, the other day I learned there is also a mobile clinic at UNC that I'll share the contact later with you, because I still don't have all the details. But that mobile clinic is besides the clinic that we have in our school, and they also offer other checks. But there are always opportunities around. I think, like any other services that I'm aware of, we can do another, live, and I can share when I know more.
Great. That's awesome. And connecting community is something that we do. That's what we invited Natalia. We bring other resources and we provide information. So this is a great resource, and we know there is many out there too. But our job as an organization is to bring this information as more cultural appropriated, better in Spanish, in English, and more deep. So Natalia is sharing who is eligible, when they can apply, those kind of things. And people can also ask. So we're going to leave all this information here as well. And actually today I'm meeting a lady from another resource in Durham, Samaritan, that we're going to also be bringing. So Connecting Community is here to provide information and bring others service providers to explain and about what they're doing, and you have the chance to ask too. That's the idea, that people really knows about what services are out there, how they can apply, who is the point of contact, because again, we sometimes feel more comfortable speaking, for example, in Spanish, right? Or in English, and we know, that organization, and Natalia is saying, has bilingual staff. They can also refer you with some of the medicine maybe that you might need. You don't need to have a health insurance. This is the time that you can do those kind of things. So if you have any questions, we're going to link also, we're going to provide the link of that, and Natalia is going to be checking to respond the question that she might be able to respond. And I think to kind of wrap us out, because we're going to have the Spanish one next to this one, I just want to invite we're going to leave the flyer, invite all the women, Latino women from 14 to 55 years old. Yes. And they're going to receive
For the
compensation
soap opera,
for the soap opera.
is 18 to 44 years old for like Latina.
Yes. So that project, you're going to receive compensation for your time. It's very interactive, as she was sharing, is through soap opera, watching those kind of chapters, and you can sign up with her tomorrow at 6 p.m. and on Monday at Duran. But you can also will find her contact information if you are interested. So we invite, if you maybe know a Latina that wanna be able to participate, please don't keep the information to you, share it, and share this live too. You know, this is a very valuable resource. You know, these studies, this access to health, even if you don't have insurance, and it's free. You know, so please share it with people that might maybe not being able, not don't follow us, so they don't know about it. Share it in your page. Facebook is also good to share things that are, you know, can be useful for people. So please don't keep the information for yourself. Share it, hit that button, and it doesn't cost anything. You just go and hit and share, right? So I just want to say thank you, Natalia, and we are going to have the Spanish one. So if you were waiting for the Spanish one, it's coming in maybe 10 minutes. We're going to be live in Spanish, right? And I just want to say thank you to Natalia for her time, for sharing with us this resource, and also um, for coming to our event tomorrow at Apex, in Apex at 6 p.m. with soccer. So if you have a kid or a girl who likes to do craft, we also have the options. If they don't want to play soccer, we are gonna have craft. The North Carolina Museum of Art is coming also with activities. We have other three agencies. We're going to have food delivered because we are partnering with Root Cause, and they're going to be amazing as always, providing us vegetables and fruit for free for the community. Also, Flor is doing food for us, so it's a family event. So come at 6 p.m. and we're going to also leave, in our social media the flyers. So everybody's welcome. Thank you, Natalia. Do you want something else to share and say bye to our community people, amazing community people?
Well, thank you for the invitation. I just want to say, like, if you want to know more about the soap opera, Ivan is going to put the flyer, but also you can go to the website, which is www. It's called Infección de Amor. If I, well, no, 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 it's a novela de amor. Yeah, we updated. Yeah, telenovela de amor.com.
Your contact, we're going to leave your email as well, right, Natalia?
Yeah, that's okay.
So if you have any question in English or in Spanish, Natalia, as we share, is originally from Chile. So that's where also I'm originally from. So we are Chilean people here. I'm excited because we are very minority within this Hispanic world. There is not many Chilean people, right? So I'm excited to have this amazing person here sharing about her resources and her love for the community. So gracias a todos. Thank you, everyone. Stay for the Spanish one connected. Keep on the look. And if you cannot see it right now, you can watch it tonight, in the evening, tomorrow, whenever you have time, because we're going to leave it on the social media of Connecting Community, Instagram, Facebook, and also we're going to do it in YouTube, our channel, so our other channel. Bye. Gracias a todos. Thank you, everyone. Stay tuned for the Spanish one. Bye, Natalia. Gracias. Thank you.